Today, we're excited to talk about Oak Street Health here in Columbus, Georgia. When you visit, you'll be welcomed by friendly staff ready to assist you. The facility offers on-site primary care doctors, a pharmacy, and knowledgeable pharmacists to support your healthcare needs. While you're there, you can enjoy games, watch TV, and relax with refreshments and snacks. Today, we had the pleasure of meeting with Sherri from Oak Street Health to learn more about their services.
Hi, I'm Michelle Crawford and with Crawford Benefits, and we're here today at Oak Street Health in Columbus, Georgia, to talk a little bit about what they're doing here in the community. And we've got Sherri Fisher.
Hello, my name is Sherri Fisher. I'm the Outreach Manager with Oak Street Health.
And I'm Jamie Meredith. I'm another agent at Crawford Benefits.
Well, great. So Sherri, tell us a little bit about what Oak Street Health is doing here in Columbus.
Well, we're a primary care provider for adults 65 and older or those on Medicare benefits. And we really are the first Hardwood location, which is a CVS product of opening a health facility in an existing CVS building and really taking up about 90% of that floor print, with a pharmacy taking up the additional 10%. So we're a fully functioning doctor's office with an attached pharmacy, full service pharmacy, and it's all designed to service and enhance the lives of adults on Medicare.
That's great. One thing that I noticed when we walked through the doors today was there was some chair yoga going on in your community room. Tell us a little bit about that.
Well, the benefit of having such a large facility, and one of the reasons why they wanted to utilize the CVS locations, is because we have this amazing community room where we have daily classes. They vary in types of classes. Sometimes they're arts and crafts. Sometimes they are physical activities, such as today where we have the chair yoga. Sometimes we're doing Zumba. We love our bingo. Our seniors love their bingo, so we do that as well. But there is a plethora of different types of classes that are going on every day here at Oak Street.
Sounds fun.
Yeah. How long have you guys been in this area? Is it just opening or?
We opened in July of 2024, so we haven't hit our first year yet, but we've had an amazing, 8 months now in the community, 7 or 8 months, and we've been able to enhance the quality physically, emotionally of the seniors that come and visit us.
Yeah. One thing I noticed too, I mean, when you come in here every time, it's bright, everybody's welcoming, it's clean, it's such a nice facility to be able to come into and has, all these different parts. It's just something really, I feel like that we needed in this area.
Thank you. That is the goal of Oak Street Health, to be a second home to those seniors that need a place to improve their health. But we do believe there's a holistic approach to senior care, which is making sure that they are thriving emotionally and socially as well. So we want them to feel welcome to come in and just hang around. We provide light beverages, refreshments, and of sorts, so they know they can always come in, grab something to drink, have a quick snack, sit down, engage with other seniors that are in the center, watch a little TV, or wait for a class to start. That's part of the environment that is created when you become a patient. So it's a second home to a lot of our patients.
Nice. I know that with all the changes in Medicare over the last couple of years, and specifically in 2025, we as agents have seen cutbacks on some of those extra benefits. One of the things that really stuck out to me was the transportation that Oak Street provides.
Mm-hmm.
And if you don't mind talking about that a little bit, I think our clients would be interested to hear that.
Thank you. So we do provide transportation for those who do not have access to a vehicle or cannot use public transportation, or don't have someone to bring them to their appointment. For those patients, we will provide transportation, pick up and drop off to their appointments, to make sure that getting to the doctor is not something they need to overcome. And a lot of them schedule their appointments on days we have activities, so they're able to take advantage of having their doctor's appointment, take a class, pick up their prescriptions, and then be brought back home. So it's a good day usually when they come to Oak Street.
Great.
Yeah, it really is a kind of one-stop shop. And I noticed in the CVS side, you have looks like not just the pharmacy, you've got a couple of other products and stuff. Just everything it seems like is able to be filled up here.
They do have, they have a smaller footprint, but it is a fully stocked store for those who are searching for items that are relatable for seniors. So if you're a senior and you need something, it's back there in that CVS location.
Are they
Small but mighty.
Yeah. Are they able to use, like, if they have over-the-counter benefits on their card, they can use that there?
For sure, for sure. The same way we're working a regular CVS, it still works in that pharmacy back there.
Great.
That's awesome.
One of the things you mentioned, we were here earlier this week for an agent meeting, and you had mentioned the priority that your patients get within the CVS pharmacy. Can you talk a little bit about that?
Well, if they're a patient here and our provider calls in a prescription to the pharmacy, they have their prescriptions filled in within 15 minutes. So they get a priority status with their medication request.
Yeah. And not only that, they can come back to the community room while they wait and play a game, hop on the computer, have a snack, watch TV, whatever it is that's going on. So that's nice.
Right.
Mm-hmm.
I've heard in a lot of the meetings that Ryan was talking about the same day, next day kind of approach. Can you talk a little bit about that and what that means?
Once you become a patient of record, which means you had a welcome visit, which I'll probably address in a second, but once you become a patient of record, we want to make sure that our patients are not utilizing urgent care or emergency rooms as a source of well-being, meaning that if we can handle it in-house, we will. So our patients, if they call and tell us they're not feeling well, most likely we're going to get them in same day, definitely within 24 hours, so that they're not utilizing these other facilities, which are not going to have benefit of monitoring their health. We want to see our patients, so we're going to bring them in-house and make sure we take care of them.
Right, and definitely lower the cost for them overall.
For sure.
Yeah,
for sure.
Now you mentioned the welcome visit, and once you get set up, what were you going to say about that?
So the welcome visit is an opportunity for you to come into Oak Street and really kind of test drive the facility before you change your provider. So you get to come in and meet with our PRM, our patient relations manager, who will review your existing benefits plans to make sure that it's aligned with the plan that we can accept, and to make sure that if you become a patient, you don't get bills that you don't expect. We all know sometimes when we go to these doctors and you switch and then you start getting bills and you're like, what are these? Well, they're going to make sure that you understand that whatever you're currently paying or utilizing for expenses on your Medicare, those are the same things that you're going to get here at Oak Street, so there's no surprises. After that, you have a 40-minute appointment with a provider who will go over your previous, current, existing health concerns and pretty much make a customized plan of how you want to address it, move forward, and get into your best health. After that, you get to decide how you felt about that experience, and then decide if you want to align and have Oak Street Health as your primary care provider. So you get to come into the facility, check it all out, have an appointment with one of our providers, and then decide if you want to align. So that's a great opportunity for people to kind of like, like I said, take it for a test drive, an interview of your provider. And I wish I had that opportunity utilizing my current insurance. I don't, but it's really awesome to be able to do that up front.
Yeah, that's great. So what is it that you're looking for? I know that you mentioned your goal is to kind of be a resource for the community, and how can we as agents help you? How can we do that?
I believe a large part of, and the reason why we partner with agents is because a lot of education needs to happen for our seniors to understand and get the most out of their benefits and to take control of their health. They're really partnered. And so once you guys do such an amazing job of making sure that the seniors have the right plans and are aligned with the best product for them, we want to make sure that they now have a provider, some place to use that's going to keep them in their best health possible, because the goal is to keep them happy and at home and out of the hospital. So by uniting and educating people of their insurance options and their healthcare options, and that they can be taken care of in a quality, safe environment where people are really happy to see them coming in. I mean, it really changes, their experience. And we can take And I want to talk about my senior men for some reason. They don't like coming to the doctor.
I don't think it has anything to do with the age.
Yeah. They don't like coming to the doctor, but we try to make sure that they especially as well are taking care of themselves. Seniors as a whole, but definitely I have a passion making sure that our senior gentlemen are coming in for those checkups and making sure that they're good.
What's the best way for either us as agents to connect people with you, or for them to get set up on their own, as a new patient to get that welcome visit?
Thank you for that question. Locally, we have an outreach team. I'm the outreach manager. We have an outreach executives that do a wonderful job of calling people back. If you refer them over to us, we will call you back and set you up with that welcome visit, answer any questions you may have, explain as much as possible for you to be comfortable to move forward with the welcome visit. And it's a pretty easy transition. Just give us a call and we're here to help. And I'm sure we'll get that information to you.
One other thing, the insurance plans that you take, as I understand it, you take nearly all Medicare plans, but original Medicare as well as the Advantage plans. Is there anything that the clients would need to be aware of? Anything? I think there's a couple of new carriers in the area that you're still working on contracting, but the major players in the area you're already contracted with.
Yes, we're pretty solid with the major plans. There's 2 new ones that are recently added, I think, to all of Georgia. We're working on those. But for the majority, we do take the Medicare Part C plans, and of course we take Medicare Part B. We also take, we work with those on TRICARE for Life who wanted to understand how to utilize the VA benefits along with their Medicare benefits, because they can do that, and partner with them. There's an education process that needs to happen a lot for the veterans who need to understand how to do that. So that's something we're also interested in because of Columbus being, so heavily in with military. So we definitely have an education process for that as well.
Great. Is there anything else you would want us to share with that you would want to say?
I want to say that the community room is not just for our patients, it's for all seniors in the community. If you're 55 or above and would like to take advantage of the classes that we have here, please just come and call us, ask us for a calendar. We love to have you in, just for the camaraderie. And like I said, the seniors come here and utilize this facility for all things. So it's open to the community. It's not just for our patients.
Great. Thank you for your time today. We appreciated having a few minutes
Thank
to
you.
share about Oak Street Health.
Thank you.
Until next time.
Thank you for watching today. If you have any questions regarding Oak Street Health, please don't hesitate to reach out. The contact information is on the screen, and we have also placed a QR code to their website. We appreciate your time and hope you found this information helpful. Take care, and we look forward to connecting with you soon.